Good afternoon, everyone. This is Jessica Nickel with the Addiction Policy Forum. Thank you so much for joining us for our webinar today on Appropriations 101. We're going to give folks another minute or so for a few more attendees to join us, and then we'll get started. All right. So today for our appropriations webinar, we're going to cover a lot of overview items and give background on sort of how appropriations works, where we are in the funding process this year in this new Congress, give you some homework and some to-do items and ideas about how to engage and encourage more robust funding to address addiction throughout a host of programs, and then answer questions that you might have on how to engage in the funding process each year, and really hope to move us as a field and as a team a little bit further down the field on being aggressive on protecting our programs and making sure that we're communicating our priorities to our members of Congress. So a little bit of background about how long I've been doing this and my vantage point. I'm a former Hill staffer and worked on appropriations and budget issues for my former boss, Senator Rob Portman from Ohio, when he was in the House. Got to have a fun job of staffing him for the House Budget Committee, and was able to learn a lot about how this process works and how advocates, families, and organizations can be influential in this process and make sure that their voices and priorities are heard as members really sort of dive through where these discretionary dollars are applied every year through appropriations. So I wanted to start off with a little bit of background about authorization versus appropriations. We had a lot of questions about this last year as we were working on CARA, the Comprehensive Addiction and Recovery Act, a lot of questions on when the funding process starts and the separate steps that you have to take for the authorizing and creating the federal program. So we'll go through a little bit of this, and at the end we can have folks type in their questions and make sure that we get into the nitty-gritty if you have more focus area or more questions specific to this topic. But authorization and all of our authorizing committees, these are the members that sit on the committees that sort of control program and policy, such as the Judiciary Committee and Energy and Commerce in CARA's case. So both of those committees helped in hearings and consideration and building the building blocks for what the CARA bill looks like today, what the law looks like. And then when that process is done and you have a bill signed into law, you have a new initiative, then it gets shifted over to the Appropriations Committees. So it's sort of like a mirror image of one another. They're called different things and have different jurisdictions, but there are 13 Appropriations Committees that then fund those programs. They decide how much of the federal purse gets doled out to each of these individual priorities. So really our job as advocates and as a field is to make sure that we are working in collaboration and communicating very clearly with both sides of this House. It's the authorizers as well as the appropriators. We need both of them. We definitely need additional policy changes. There's more bills coming down the pike, more things that we need on our agenda on how to create and focus on a comprehensive response to addiction on the policy end. And then of course we want to see in not just CARA, but CURES and many other programs. We have 34 that we've identified to have continued funding in fiscal year 2018. That's the bill that they'll be working on throughout this upcoming summer. So a little bit more of a metaphor to sort of break this down a little bit further. I've described the difference between authorizing and appropriating as a little bit like building a car. So at first you go to step one, the factory to build the car. This is where you meet with your engineers and the designers, and then you have the mechanics and the assembly line, and all of these pieces build your car. And some of the cars are, little tiny smart cars, and others are, big Humvees and Mack trucks, because there's a host of programs and initiatives that go through our authorizers that have to be built and created. They are the builders. That's where our factory is. Once that car is built, it needs to go across the street to the appropriators, which is fueling it up, making it go, putting the money into each of those cars, those programs, those initiatives, to make sure that they work. So we need both sides of this, right? We need the car built before we send it over to the appropriators, and then of course we also, even when we have a law like CARA or others that is signed into law, there are tweaks and additions that can be made as you take that model and advance it and make tweaks over the years. So this is, at least in my 21 years being down here in DC doing this work, this is the best way that I can explain how the authorizers and appropriators work together. You need to have both of those steps to make sure that you have a car that's built well, that has great design and has all of the pieces that you need to make it go, but also has the fuel to make sure it can get you where you need to be at the end of your destination. And for us, it's for CARA, it was creating that comprehensive response and having each of those 6 pillars covered in programs that can provide resources to communities. So here where we are in the timeline. This year with a new Congress and a new administration, we are a little behind, and this timeline is modified a bit. In February, when we usually get the full budget from the administration, from the White House, we got what they are identifying as the skinny budget, which means it was just top line of a very sort of reduced version and smaller summary of what the administration's budget proposal to Congress will look like. We are expecting the full budget in May. And that will have an impact on what some of the numbers look like and what Congress has to do as they finish their appropriations process. Now, the budget is the framework that the administration lays out. And it does impact the overall numbers that each of the committees, those appropriations heads, are given. So it is something to pay attention to. But at the end of the day, it is the appropriators, the appropriations committees in Congress will decide ultimately if they're going to pick up any of those program recommendations in the budget, if they're going to ignore them altogether, reduce dollars below what the White House has listed, increase dollars, fund things that aren't even in there. There's a lot of authority and flexibility within the appropriators to prioritize what they really want to see receive dollars in the coming year. Right now, we've already seen our appropriations deadline, at least internal, on the House side completed. We have some time, and we're looking at a delayed deadline for the Senate. So there is still time for us to all engage and make sure that our senators are aware of our appropriations priorities and what we want funded. Our belief, though, is that for 18, and we're really talking about this next big bill for 18, we anticipate markup and Congress considering these bills in June and July, so we will, I hope, get back on track. Now, we're still in the process of figuring out what's going to happen with 17. It looks like an omnibus or a CR, depending on how negotiations go. In the next week or two, once members are back from recess. For us and for CARA, we've received a anomaly. So the startup funding for both CARA and CURES came out of the December bill, where they did the extension for the funding bill and then added some dollars in the interim for these 2 programs in the addiction arena. We're hoping that there is an opportunity to see those additional dollars for at least CARA in the Omni or in the final bill for FY17, 2017, which ends September 30th of this year. Either way, that bill is going to be very important for us to track and to pay attention to, because there are a lot of other programs that all of us on the phone are focusing on and want to see continued, things like drug courts and the substance abuse block grant, the medication assisted treatment funding. We're tracking the Burn JAG block grant, so on and so forth, the level of funding for NIDA within NIH for research. So of the 34 that we're still sort of waiting on, if there is a continuing resolution for FY17, that means that those programs will be continued at the same level, the sort of consistent level with 2016 levels. So we'll provide updates for all of our members and everyone that's tuned in today to make sure that you get information on where all of these programs stand, but we are still in limbo and waiting for them to finalize that. Talked a little bit about budget. That's a framework and important to pay attention to, but at the end of the day, appropriations is the real deal, and it's our appropriators that we need to establish very strong relationships with and update them annually. Appropriations is a annual process. Every single year, these appropriations committees are diving into what gets funding and what doesn't, and we can't sort of declare a win on CARA or on any other policy arena and think that our job is done. In many ways, I've always said that the work really begins and you have to roll up your sleeves once a program is signed into law to really make the case that it's deserving of resources. Now, in terms of prioritizing, between the 34 programs that we're tracking, and I'm going to walk through those really quickly in a minute, we're seeing that there's 3 main committees for us to track. So that means there's 3 appropriations committees that have jurisdiction over programs related to how we respond to the opioid epidemic and addiction funding, treating substance use disorders. Those committees are Commerce, Justice, Science, which funds the Department of Justice. There's CARA funding there, drug courts, RSAT, et cetera. HHS funding, which is in the Labor HHS Appropriations Committee, that funds SAMHSA and all their programs. And then Financial Services, which funds ONDCP, and there are key programs like HIDA and Drug-Free Communities that are located in that agency and under the financial services jurisdiction. So these cardinals, I know, and sometimes I get strange feedback on this slide in particular on why we call them that, and I don't even know why we call them this, except that if you're a cardinal, meaning you're the chairman of one of these appropriations committee in both the House and the Senate, it really is up to you and your ranking member. Right now, your top Democrat on the committee to ultimately decide which programs get funded, what the funding levels look like, any of the policy or guidance that's given during the appropriations process. And we have 3 cardinals and their chairman and their ranking members, in each of our House and Senate folks that we really need to communicate that we are paying attention and feel strongly about continuation of funding to address addiction. So some of those members, and I did not have enough room to put them all down here, but it gives you a sense of what we're tracking. But just for our cardinal outreach, John Culberson and Jose Serrano that are doing DOJ funding on the CJS committee in the House. We have Graves and Quigley on financial services, Rosa DeLauro for Labor H on the House side, and then of course we have Shelby, Jean Shaheen on CJS on the Senate side, and other members. So we have this information in packets and toolkits for everyone to download after the webinar, but making sure that each of these cardinals and all of your members of Congress and everyone that's in your delegation knows what you want funded and that you care about these issues is the time is right to make sure that those communications and letters are submitted. Now, a little bit into the programs that we are tracking for everyone. We sort of broke this down by committee, by the Appropriations Committee, and narrowed it down to 34 key programs to ensure continuation and robust funding to address addiction. So the first category and table that we put together was on the treatment program, the treatment side. And as you can see from the block grant, we've identified what last year's funding level is, and then what we're looking like for the proposed 17 bills that are still being considered. We have HRSA, the community health centers, there's drug court funding, SBIRT funding, MAT. A lot of these are consistent, but as for example, this MAT program, second to the last, we saw a larger mark out of the Senate than we did the House for the FY17 bills. We saw identical funding for the Pregnant and Postpartum Women Program, and others like the community health centers. There was an earmark for opioid abuse. We saw that language on the Senate bill, and we didn't see it in the House bill. So giving you this information so you know where we stand and what we can ask for can inform your communication with your members of Congress. This is sort of just page 2, a continuation. We're also tracking some drug court, some vet court funding, as well as RSAT and prescription drug monitoring. The total in the treatment account that we're tracking is $2.5 billion that was funded in FY 2016. We're hoping to see if we end up in a CR, a continuation of that 2.5 in FY 17. If not some plus ups, if there's an opportunity for an omnibus bill, a larger bill that has new language and new programs in it. That does not include the addition of the CURES money. I'm sure everyone saw yesterday the announcement that Secretary Price put out the $486 million in awards to states to address the opioid epidemic from the 21st Century Cures Bill. And so that will already be a plus up in the FY17 numbers as we're moving forward. The next account is prevention. We're tracking the Drug-Free Communities Program, which is in the Financial Services account under ONDCP, a CDC prescription drug overdose program, as well as the Strategic Framework Program at $10 million. We're looking at pretty consistent funding marks in 17, and as you can see, it's a much lower mark than our treatment table, and we want to make sure that we are holding the line there and hopefully increasing it over time. The recovery side, we are tracking Safe and Stable Families, which is more of a child welfare program, but with all of the overlap of services that are needed in child welfare cases in the event of parental substance abuse. We're tracking that and seeing if we can ensure continuation funding. And then one SAMHSA recovery program, the Recovery Community Services Program at $2.43 million. This does not include the separate CARA dollars on recovery or prevention in the category. We put CARA in a separate table. Research and policy, we are working with key committees to make sure, and again this is sort of labor H champions and cardinals, to make sure that NIDA is continued. The FY17 number, that we do have a House number, we just didn't put it in there, so we'll send an updated document out to everyone. But ensuring that we hold the line on our research on our issue is incredibly important, so we'll continue to track NIDA funding. Enforcement, most of this comes out of the DOJ account, so the Commerce, Justice, Science, Appropriations Committee. We put in both DEA as well as grants to locals with the Burn JAG program, HIDA, the National Guard Counter Drug Program, and the meth task forces. The total level of FY16 that we're tracking was the 3.8, almost $3.9 billion, and it looks like our marks in the House and Senate are largely level, so we are anticipating level funding on the enforcement side. Now here's CARA. So there's little stars by these numbers to do a quick side note to explain. So obviously we didn't receive funding for CARA last year in 2016 before it was signed into law, but we were able to receive that anomaly. And that is sort of a addition that they made in one of those extension bills, the continuing resolutions for funding for FY17. So we are going into this process with a $37 million funding for CARA, and it's our hope that we will grow that in FY18. This is just the individual breakdown of CARA authorizes $181 million in programs across those 6 pillars annually. And we'll get a little bit more into this. It's ultimately up to how much appropriations we can get to see if we can fund each of these programs, and if there's lower levels, then the agencies have some flexibility and oversight over how those programs are prioritized. So here's a little bit more breakdown, which I think is a little bit easier to read, on explaining the categories and the main components, what we call pillars of CARA. So the prevention and treatment and recovery components of CARA are in the Labor H jurisdiction. The prevention side also, the financial services has one program, the Drug-Free Communities Enhancement Grants. That's a part of CARA that they will oversee. And then the law enforcement provisions, the criminal justice provisions, particularly the alternatives to incarceration that CARA creates, and the many of the overdose reversal, the naloxone programs, are in the DOJ jurisdiction of CARA. So that's the CJS committee that's determining the money that we get for 3, 5, and 6. So these are the big buckets of dollars that are coming out of CARA. Now the first round of those grants, because of that anomaly funding of $37 million, those grants, the deadline is this coming Tuesday. So for those of you that are working with jurisdictions that are applying for those dollars or getting geared up for next year, we're already seeing sort of this come to life, and the first round of grant applications hit the streets. We're anticipating the second round, which will cover 1, 2, and 4 out of SAMHSA, should be ready in the next 6 weeks. So I wanted take a quick second just to explain CARA versus CURES. As I mentioned the CURES dollars being announced yesterday, going to states at varying levels, varying funding levels. CURES is 2-year supplemental emergency money to deal with the treatment gap. The application the deadline was in February, and the award just being made yesterday. This is a program that Congress created as part of 21st Century Cures to deal with our treatment needs right now on an emergency basis or on a timely basis, and it's authorized for 2 years. There's $500 million for FY 2017, and there's $500 million for 2018. It does not extend beyond that. Its focus is on treatment and recovery support services. The applicants are just states, though many of the states are working in concert with local jurisdictions on how those dollars are spent. This is an important supplement to CARA because it's getting much more dollars to help with treatment and to address the treatment gap out to communities. CARA is authorized for 5 years, and sort of these more traditional grant programs are commonly reauthorized at that point. It has $181 million of annual authorization over those 5 years. And it's across 3 different grant programs, 3 different committees, and has about 10 to 12 grant programs that can come out of those categories. So that's just a quick overview of how these, they're kind of like sisters in my opinion. So they're sisters that work together, and we need both of them, and we need to ensure continuation funding, particularly moving into 2018. So here is the fun part where I give everyone homework. As I mentioned, the timeline is different. So we have almost a little bit of a teacher giving us an extension on our paper to make sure that we are using our voices and making our priorities well known among our entire delegation. Every year I sit down and make sure that my 2 senators and my 1 congressman know what I want funded as their constituents, as one of their constituents. So we have put together a toolkit for everyone to do the same when it comes to addiction funding. You can put any combination of those 34 programs into these sample letters that you desire. I would not recommend that you put more than 5 programs in, otherwise the staffer that has to open your letter will feel entirely overwhelmed and not know what to do with us. But figuring out what your priorities are on this list or other issue areas that you care about, and making sure that you take the time to construct a letter that's personalized, particularly if you have, this is the work that you do, your agency is focused on this, you do clinical work and practice, you're in criminal justice, if you're a family member impacted, have a personal story to tell, taking the time to put that on paper and be very clear that these are the 5 programs I care very much about continuation funding for in 2018, and I ask that you engage to ensure that that happens. This is a time to get those in, particularly for your senators, but I would say that it's better to make sure your entire delegation is aware of your priorities and what you want to see dollars, which of these cars you want to see filled up. The other sort of to-do list items are: 1, once you have your letters constructed, set up a call with each of the lead staffer on this issue for your 3 members of Congress. If you are with an organization that serves a larger area, you'll have a much bigger delegation that you can engage with. At a minimum, it will be 3 members though. So set up a call, set up a meeting when they're in the district or in your state, come to town and to take the time to visit with them and start explaining to them why you focus on this, why you care about these issues, what your asks are. I would lead with appropriations first because of the timeliness, and then this is a good way to start a conversation so you can follow up with your next program, policy, and other bills that you're engaging around. But this is approach season, so it's a perfect opportunity to make sure that you set up those calls and meetings to make that happen. Stay involved and sign up for our newsletter to make sure you get updates on tracking these programs. We will let you know anytime there is an update on the funding side. We should know within the next 2 weeks because we're looking at a deadline, coming up on a deadline to make sure the government doesn't shut down. So we'll have an info on whether this was a CR and what those 34 programs look like. Did we get more money for CARA? Did we get higher marks or level funding? Is there an omnibus that's on the table for larger funding changes? But we will keep you updated, and you can always engage with your members of Congress and share this information with your own networks at home. That's another key component of this, is the more folks you can wrap in. I think every time I email my senators because I want them to do something, support CARA, support treatment or medication-assisted treatment or a new bill that I'm engaging, I share that on my Facebook page to make sure that everyone that knows me knows what I'm advocating for, and you can bring more people into the network of advocating for these programs and these resources that we so desperately need. And then continue that outreach throughout the year. We'll have more stuff that we're working on. If you have an event or an opportunity to invite your members of Congress or even their staffers, that's a great way to get folks engaged and care further about our issues and make sure that they are well informed and educated and have new information and new reasons to engage. So that is our overview of appropriations. So I thought I was trying to finish in 30 minutes, and I think I actually finished a minute sooner. And now we can have time for a little bit of Q&A and any of the specific questions that you have about approps, the budget, the difference between authorizing and appropriating, toolkits, or your homework. Just let me know, and we're happy to walk through any of that. And I think to ask questions, you have to type it into the chat, which is at the bottom right hand of your screen. Any? Give people a few other minutes. I included a link here, but we will send the PowerPoint slides out for everyone, as well as this toolkit for submitting your letter of funding priorities as soon as possible. If you need other materials or other information to finish this, just let us know and we're happy to help. Oh. We have a first question came in. Can you explain when the budget year starts and ends? So the new fiscal year begins on October 1st. So we will be in fiscal year 2017 until October 1st of 2017 when FY18 begins. I know it seems kind of crazy since we're so far into the 2017 fiscal year and we have yet to finalize our approps bills, but excuse me, every year that's the timeline that we're working on. any other questions? One other item on timeline is I typically like to really start advocacy efforts in January of every year. So as we start as a field working on fiscal year 19, that's just going to be in January, doing these same letters, outreach, making sure we have our champions engaged, and then working with each of the cardinals and the committee staff to have information about our programs. All right, looks like we don't have any other questions. So again, we will share the PowerPoint slide deck as well as the toolkit for your funding priorities letters. And if you need anything else, please let us know. And thanks again for joining us for the Appropriations 101 webinar.